first speaker, James Adams, is President's Professor and Program Chair of Materials Engineering at Arizona State University. He also directs the Arizona State University Autism Asperger's Research Program. Please help me give a warm welcome to this morning's speaker, James Adams.
Thanks very much. I'm amazed to see so many faces earlier on a Saturday morning. I'll do my best to make it worthwhile to get up early. Thank you for coming. Just a quick disclaimer, I do not have any financial interest of a product in my talk or with any companies offering grant money for this continuing dental and medical educational program. So I have basically 3 talks packed into one that I want to give. The first one is on mercury release from new dental amalgams. The second talk is looking at mercury and other toxic metals in autism. And the third talk is looking how to treat heavy metal toxicity using several different chelators. So I'll tell you about studies we've done in each one of these areas. So I'm a materials engineer, but because I have a daughter with autism, she's now 21, about 12 years ago I also began doing research on autism, looking at the causes of it. And that was what led me to this work on autism. I have published over 130 articles in peer-reviewed journals. And particularly I want to point out, I'm going to be talking a fair bit about thermodynamics of materials. I've taught undergraduate and graduate thermodynamics several years at our university. Our university, Arizona State, is the largest university in the country with 75,000 students. So this, what I have to say to you, I hope you think is fairly credible. I even have an award from President Bush for some of the work we did. So also I'll just recognize Mike McKelvey, who directs our Goldwater Materials Labs, my student who did some of the work, and then Mike Margolis, who's an IAOMT member and a member of, and he has a private dental practice in Mason. He helped make the samples for us, probably the last mercury fillings he's ever made for us. So just a little bit of background. This is basic science that we teach all of our junior materials engineering students, and it's just amazing how this is just not understood by the ADA. Every material has an equilibrium vapor pressure. Every material, every solid is constantly emitting atoms from its surface, and atoms in the vapor phase are depositing on that surface. It's a continuous equilibrium. So every material that has an equilibrium vapor pressure associated with it. By definition, the melting point occurs when the liquid and the solid have exactly the same vapor pressure. So liquids have high vapor pressures, but a solid at the melting point has exactly the same vapor pressure. That's when they're in equilibrium with one another. And when you go down in temperature, solids still have a vapor pressure that's not that different from the vapor pressure of a liquid. There have been previous published studies of mercury release from dental fillings, generally looking at old fillings, and those rates are generally in the range of about 1 microgram a day of mercury, but a few reports have put that number higher. There's not very much data, however, on the amount of mercury that's released from a filling the first day it's made. The thing, and the reason we wanted to look at this is that when a mercury filling is first mixed, when it's first triturated, the challenge is that the liquid, it's going to take time for the liquid to diffuse into the solid, for the liquid mercury to mix with the rest of the material. During that process, there's going to be a gradual transition in the equilibrium vapor pressure of mercury. But in any solid, if a solid is 50% mercury, for example, the reasonable first guess as to what its vapor pressure would be, so that it's 50% mercury, it's going to have 50% of the vapor pressure of pure mercury. That's just standard materials engineering. Some materials a little bit higher, some a little bit lower, but it's basically a rule of mixtures. If your material is 50% of one element, then it's going to have approximately 50% the vapor pressure of that element in the solid phase or in the liquid phase. So that's just standard. So we should expect that when we first mix a dental filling, it's going to take time for the liquid to react and diffuse into the solid. It's going to take time for its equilibrium vapor pressure to change, but its equilibrium vapor pressure is not going to change a great deal. So the key question really is how much mercury is emitted from a dental amalgam during the first few days or weeks. So that's what we wanted to investigate. So in order to measure this, we used an unusual method for measuring it. What we did was we first just used a standard triturated mercury amalgam sample using a commercial single spill sample under the supervision of a board-certified dentist, Dr. Margolis. Then we stored the samples in dry air for 0 to 21 days at body temperature. So we're storing them at body temperature, but we are storing them in dry air. Well, in Phoenix, it's pretty dry to begin with, but we are storing them in dry air because water vapor would interfere with the measurements. We then use a method called thermogravimetric analysis to measure the weight loss. We're going to measure the change in weight of the sample because over time, what's going to happen is as mercury is emitted from the solid, we're going to be able to measure the weight change of that solid and measure very quantifiably how much mercury is being emitted. So other groups have tried to measure the amount of mercury in the vapor. That's a bit trickier to do. Are you catching all the vapor? How much of it might be going into your apparatus? Here we're just looking at the change in mass of the filling using a very, very sensitive measurement technique that we have. And for each sample, we'll measure the weight loss over typically 24-hour period, holding the sample, and we'll also look for any other gases that might be emitted during that. And so we tested two types of samples. We tested a dispersed alloy, which is an older low copper sample, and then we tested contour, which is an example of a new high copper sample. So we found quite different results for those two types of alloys. So this is the data. So the vertical axis shows the mass loss of mercury as a function of time. So each dot there represents a different sample. So we leave a sample out in dry air for 1 day, 5 days, 10 days, 20 days, and then we would measure over the next day what its mass loss was at that time period. So the first thing to realize is that in the top figure, we see that the first day there's a very high loss, second day there's still a high loss, fourth day and onwards there's still a relatively high loss compared to the 21st day. But certainly at the first few days it goes down quite a bit. And then also notice that these two curves are on a different scale, that the bottom curve goes 0 to 2, the top scale goes 0 to 8, and that's because in the dispersed alloy we found significantly lower amounts of mercury being released. Still a lot the first day, but not as but lower by about a factor of 2 or more. We also then did what's called a residual gas analyzer. So when we put these samples into our TGA, we wanted to measure the change in mass, but we needed to also measure what gases were coming off of the sample. It takes about 4 hours for the sample to equilibrate, so we can't measure the mass during the first 4 hours, but then we can measure it for the next 24 or so. And what you see are peaks, which are only the first set of peaks. Let's see if I have this. So this first set of peaks is for mercury in the +1 state. You have slightly different peaks because each peak corresponds to a different isotope of mercury. Mercury has a fixed number of protons, but slightly different numbers of neutrons in the nucleus. So you have slightly different isotopes. Each peak corresponds to a mercury isotope. And over here, we have the peak for mercury +2. Some of the ions in the residual gas analyzer can get a +2 charge. You'll notice there's absolutely nothing else present. The only gas coming out of these mercury vapor fillings is mercury vapor. When we look at it under a mercury vapor lamp, you can actually see the cloud of mercury coming out of these fillings. It's very clear, very visual. My undergraduates always get excited when I show them a picture of it. And then total mercury release rate. At day 1, the contour released about 295 micrograms in one filling. Now again, an old filling you might guess is losing about 1 microgram. So a brand new filling the first day is losing about 300 micrograms, whereas the dispersed alloy is releasing about 100, so a lot less. Now over the first week, the total amount of mercury that's released the first week, 780 micrograms, and whereas for the dispersed alloy, 160. To put this in perspective, the FDA warns pregnant women not to consume a single serving of shark or swordfish during their entire pregnancy, because one serving of shark or swordfish during the entire pregnancy is known to increase the risk of neurological damage. Doesn't mean there will be, but it's enough to increase the risk. So one serving of shark or swordfish would have about 200 micrograms in it and that's one serving over 9 months. You're getting that in the first day from a contour filling. Over a week, it's like eating 4 servings of swordfish in that first week. So the amount per filling is for a single spill filling. Most fillings, as I'm sure you know, are 1 to 3 spills. Now this assumes, in our measurement, we assume all the filling is exposed to air. The actual exposure to air may be quite a bit less. It might be only a quarter of that. On the other hand, we're not measuring the amount that will be emitted into the bone, into the tooth, into the saliva, so there may be additional losses through those other regions. But we didn't measure that. We're just measuring what's in contact with the air. So there are some limitations to our study. The actual release rates for the first 4 hours we couldn't measure because it takes about 4 hours for our mass analyzer to equilibrate. So the actual amount of mercury being released is actually going to be higher than what I've told you, because we can't measure the amount being released the first 4 hours, but I'll guarantee you it's higher. It would just raise it. Now, our current study involves samples stored at body temperature, which is appropriate for placement in the body, but we stored them in dry air, all right? In a human mouth, of course, it's going to be a moist environment. The moisture will accelerate development of an oxide layer. So there are ingredients, especially tin, but some of the other ingredients in these fillings that will form a protective oxide layer that will tend to result in less mercury release. And that's one of the main reasons. There are basically 2 reasons why mercury release changes as a function of time. The major reason is the development of that oxide layer. A secondary reason is the mercury does react and change from the liquid state to a solid alloy with the rest of the amalgam. That will only reduce the vapor pressure by about 50%. So most of the change in release rate is developed due to that oxide layer. So then if you had a human mouth with water, it might accelerate the development of the oxide layer faster, so you'd have less mercury release. But brushing, or even worse, if you gum chew, will result in more mercury release. So I'll show my students, we'll bring them in, we'll show them a mercury filling, not releasing very much, then we'll brush the surface, and then you'll see a cloud of mercury coming off of it. So again, there are limitations to doing the type of study we're doing, but the reason we did it this way is we gives us very, very precise measurements using very advanced methods for changes in mass. So to conclude with, mercury amalgams emit dramatically higher. I expected somewhat higher. I didn't realize it was going to be 100 to several hundred times higher than from an old amalgam. During the first few weeks, I then reported in literature. And so most of the studies in literature are on old amalgams. There are a couple, however, on new amalgams that are consistent with ours. The 2 other studies do show that high copper alloys, which are the ones primarily in use today, seem to release much more mercury than older low copper. Now, there are variations from one alloy to another, so I can't say this holds for every high copper and every low copper. Those are just typical examples of alloys. The amounts emitting during the first week are far in excess of FDA guidelines for exposure to methyl mercury. They don't have, of course, any guidelines for exposure to gaseous, vapor phase mercury. In vitro studies would be needed to more exactly quantify the release from new fillings, but after seeing this data, okay, how much more do we really need? So this work was funded by the Wallace Foundation, a private foundation. It was published in my student's master's thesis. I will try to finish up writing the article that we've begun. We're 95% done. I just need to finish writing it. Okay, so now I'm going to move to the second talk. I'm going to go through this one kind of quickly, but I think there are several things to hopefully learn from it. So the main question we asked are, do toxic metals and toxic chemicals affect the risk of autism? And now it's pretty well established. There have been 40-some papers, and most of them agree that yes, toxic metals can increase the risk. But not all of the data shows that, but most of it does. So I'm just going to summarize the talk first. Toxic metal exposure at dangerous levels is common in the U.S. The symptoms of mercury poisoning mimic that of autism. Children with autism have a decreased ability to excrete mercury and other toxic metals because they have low glutathione, which is the primary defense against toxic metals. Children with autism have high levels of toxic metals in their body, looking at them in a number of ways. The severity of autism correlates so that the higher the amount of toxic metals, the more severe the autism is. Several epidemiology studies link toxic metals and toxic chemicals with autism risks. When you have higher levels, you have higher risk. The only mixed data is in thimerosal and vaccines. It's very controversial. And then finally, DMSA therapy removes toxic metals, and in the study we did, seemed to reduce symptoms of autism. So very quickly, toxicology basics. 1 aspirin a day for 60 days is safe. 60 aspirin in 1 day can be lethal. You're overwhelming the body's detoxification system. Fetuses and infants are generally more vulnerable than adults to toxic metals. The toxicity of most chemicals, individual chemicals, is not well understood, and the synergistic effects of them is even worse understood. But if they have the same excretion mechanism, you can expect that to be a synergistic problem. So one classic example of synergistic toxicity, an old study done by Schubert, individual doses of mercury that were sufficient to kill 1% of animals, or lead that were enough to kill 1% of the animals. If you give them both of them, you overwhelm the body's detoxification system, and 100% of the animals died. That's an old study. It would be nice to see a newer follow-up. Lead toxicity, which we know the most about, we've known it's a toxic material since the 2nd century BC. We know the major sources of lead are leaded gasoline, lead paint, and lead pipes. In the 1970s, the average child's lead in the U.S. was 15. At a level of 10, they have lost 4 to 7 IQ points. This is probably the biggest environmental disaster in the U.S., is that in my generation, or slightly after my generation, the average child in the U.S. lost 4 to 7 IQ points from lead alone. But it's a success story that now we've gone from a level of 15 down to a level of 1. But still, even at a level of 1, it's clear from research studies that it's increased risk of ADHD, of aggression, and other problems. Safe levels were once thought to be 60, then 45, then 20, then 10. There's now known that a level of even 1 is unsafe. So the more we know about toxicology, these levels have dropped tremendously. Lead affects all organ systems, nervous system, kidneys, heart, immune system, reproduction. It goes everywhere. So I just mentioned that briefly because it's the element which we know the most about. For mercury, and forgive me, I'm sure most of the audience knows this, mercury damages and kills neurons. It replaces zinc and enzymes, affecting over 80 enzymatic reactions in the body. Mercury, when it binds to glutathione, glutathione is excreted with the mercury into the bile. So for every atom of mercury, you're losing a molecule of glutathione. And it also has a second effect, that it inhibits the production of glutathione. So it has a dual challenge to glutathione. According to the Agency for Toxic Substances and Disease Registry, this is a branch of the Center for Disease Control. This is straight out of their one-page summary of the effect of mercury in infants. Mercury is considered to be a developmental toxicant. Symptoms in offspring of exposed mothers are primarily neurological, have ranged from delays in motor and verbal development to severe brain damage. And that's what you see in autism. The infant may be born apparently normal, but later show effects that range from being slower to reach developmental milestones, such as age of first walking and talking, both seen in autism. More severe effects, including mental retardation. Depending on the study, about half of kids with autism have mental retardation. Many of them have poor coordination. And in extreme cases, in very high amounts, you actually develop paralysis. Other severe effects observed in children whose mothers are exposed include eventual blindness. Kids with autism don't have blindness, but they have significant visual challenges. Involuntary muscles, contractures, and seizures. About 1% of the general population have seizures. About 25% of kids with autism have obvious seizures, and about 60% have subclinical seizures, abnormal EEGs. And inability to speak is one of the 3 hallmarks of autism. Important to remember, severity of these effects depends on the level of mercury exposure, time of dose, and the form of mercury. It should say too, but they didn't say that. So there's a paper a number of years ago by Sally Bernard, published in Medical Hypothesis. That was the first one that really got the autism community to look at autism possibly being linked to mercury. and she just shows in a very nice literature review the major hallmarks: speech language deficit, mental retardation, social withdrawal, poor coordination, unusual behaviors. And autism is about 4 times more common in males versus females, and males are more sensitive to mercury poisoning than others. We're the weak gender, I hate to tell you. Okay, so mercury exposure at dangerous levels is common in the U.S. The FDA estimates that 1 in 6 women in the U.S. have mercury levels placing infants at increased risk of neurological damage. That used to be 1 in 10, but now we know that the mother's placenta concentrates mercury to a higher level than in the mother's body. So-called silver fillings are actually 50% mercury. Well, you know all that. Thimerosal was injected into infants at levels 25 to 100 times the safe limits until around 2003, when the FDA recommended it be removed from childhood vaccines, but it's still in some vaccines like the flu vaccine, which is given to pregnant women. Mercury in seafood, you probably know that, so I'll skip it. This is straight from the FDA website. So some seafood is much lower amounts of mercury than others. FDA recommendations: just limit the amount of high mercury seafood, don't consume any. And note that nearly 100% of mercury from seafood is absorbed into the body. But that seafood that's absorbed often has selenium bound to it, which is an essential mineral and helps to protect against the effects of it. Our dental fillings don't have any protective selenium with them. So, SAM and glutathione, decreased SAM or accidental methionine and glutathione in mothers of children with autism, and I should say fathers, and has been shown also in their children. SAM is the primary methyl donor in the body. It turns proteins on and off. It turns DNA and RNA on and off. Very important for early development. Glutathione is the primary antioxidant in the body and also the primary defense against toxic metals. The problems in these areas she's shown, and other people have shown, are easily treatable with a special type of folic acid called folinic acid and the methyl form of vitamin B12. Just very briefly, this is the methionine pathway. So methionine is one of the essential amino acids and will be converted to SAM, which is the primary methyl donor in the body. Then it goes on to form homocysteine, which then goes on to form glutathione. And glutathione is recycled between the reduced and the oxidized form. In order to recycle some homocysteine back to methionine, and women are better at recycling this than men are, you need vitamin B12 and you need 5-methyl tetrahydrofolate, which comes from folic acid or folinic acid. And so these two vitamins are essential to normalize SAM and glutathione. And so in a study of 200 mothers of typical moms and 46 control moms, she found that half of the mothers of kids with autism had abnormal SAW, half of them had an abnormal ratio, 65% of them have an impaired ratio of active to inactive glutathione versus very few of the controls. So if you have both of those problems, 41% of autism moms have both of those problems versus 3% of controls, and that leads to a relative risk of having autism of 46 times. Now, I want you to remember that 41% number, because then she asked a question several years ago: would testing for abnormal methylation in glutathione in mothers or newborns and treating it reduce the risk of autism? And an easy way to test for it is just measuring homocysteine levels. But there was a stunning study that just came out that showed if a mother took folic acid during pregnancy, this is a large study of 429 autism families, 278 typical families, they found that right at the first month of pregnancy is when it was critical. Later months it didn't matter, but right at conception, the autism moms had significantly lower amounts of folic acid, not hugely lower, but that was enough that if they had a level above 600 micrograms, they had a 38% decreased risk of having a child with autism. This is huge. This is the first major finding on how to prevent the risk of having a child with autism. I should have mentioned autism has grown greatly in incidence from 1 in 10,000 to currently now 1 in 88. Some of the latest studies even put it at 1 in 50. All right. It seems to be especially important for mothers who have a particular genotype, a defect, I shouldn't say a defect, but an alteration in their MTHFR. This is backed up by a second study of 85,000 Norwegian children, including 270 with ASD. This study was done right at a time period in Norway where we implemented nationally adding in 400 micrograms of mercury. They could, 400 micrograms of folic acid. And then they found that, again, if you look at the critical 4 weeks prior to conception to 8 weeks after, they found that if they had that extra folic acid, they had half the rate, half the incidence of autism. So again, a 39% lower risk of developing autism if they took prenatal folic acid. Little benefit if taken after 8 weeks. Now again, what do we think is the major role of that? It's to produce SAM-SAW, but it's also to produce glutathione, the major defense against toxic metals. So if you're working with toxic metals like mercury, taking extra folic acid and B12 makes very good sense. There are several studies in children with autism that show those same issues. It has been shown that if you have impaired glutathione, the fetus will be more vulnerable to toxins. There's 2 studies that have been done looking at, one study of airborne mercury and one of pesticide exposure, showing that higher airborne mercury or higher pesticide exposure will increase the risk of developing autism. There was a very fascinating genetic study showing that some animals have a genetic vulnerability to mercury. So Maddie Hording injected thimerosal, which is a mercury-based preservative used in childhood vaccines. She gave them at doses equivalent to that given to a human infant. Now this is stunning because thimerosal was used for over 70 years as an additive to vaccines, but this is the first safety study ever done of thimerosal in infant animals, and it was only done 70 years after it's been used. And the study showed that and she's at Columbia University, credible person, she found that 2 strains of mice were unaffected, but 1 strain, which is known to have autoimmunity issues, was vulnerable. And just the amount of thimerosal present in a typical human vaccine scaled to the mouse body weight led to growth delay, reduced ability to move, unusual response to novel items, and abnormal development of neurons and synapses, suggesting that some subset of humans might be genetically vulnerable to mercury. And in fact, it turns out that there was a disease from 1890 to 1950 called acrodynia or pink disease. It caused serious developmental delays, and in fact 20% of the children got a high enough dose that they died from it. It was eventually discovered being due to the use of mercuric chloride in teething powders, and in fact that was the active ingredient, presumably because the mercury chloride would then numb the nerves in the mouth and the child wouldn't cry from teething anymore because the nerves weren't working. Great. And we've collected samples of these 50-year-old samples. We've tested them in our lab. Sure enough, they have just what they claim to, high amounts of mercuric chloride. Curiously, it only affected 1 in 500 children, that there seems to be this rare genetic vulnerability to mercury. Almost new cases since the 1950s when it was removed. It was pulled from the market, there were virtually no new cases of acrodynia. A recent study, which is really interesting, they looked at survivors of acrodynia and they looked at their grandchildren. There were about 1,000 grandchildren, and they found they had a much higher incidence of autism, 1 in 25 or about 4%, compared to about 1 in 150 in the general population. So this is strong evidence that this population had a rare genetic vulnerability to mercury, but it's only a problem, of course, if they're exposed. If you don't expose them, they do just fine. So evidence of toxic metals in children with autism, I'm going to go through this quick, but there are studies of hair, blood, urine, porphyrins, which is a nice indirect way to test DMSA challenge, epidemiology. The challenge is that mercury, lead, and other metals have a short half-life in blood, several weeks to months, and then they move to organs or bones. Especially lead moves to bones, mercury moves to kidney and brain. So it's difficult to measure in the tissue. We can't easily get kidney or tissue or brain samples from our kids, so it's difficult to measure, so we have to use all these other indirect methods to measure. So this is a study by Boyd Haley, who's also a member of the SAB. You've probably seen it. But they measured the amount of mercury in typical kids and in kids with autism in their hair. Now this is really strange. And they were very puzzled by it first because the kids with autism had lower amounts of mercury in their hair compared to the typical kids. Why is that? Well, you could argue that hair is an excretion mechanism, so maybe they had less ability to excrete mercury. So then they broke the kids with autism up into mild, moderate, and severe, and they found the most, so now I'm blowing up the scale for the autism kids. The kids who were most severe had the lowest amounts of mercury in their hair compared to the milder cases. So again, suggesting it's a measure of excretion. When I showed this data, I took this data and I showed it at a formal meeting with the director of the National Institute of Health, the branch called NIEHS that deals with environmental health. When I showed him this data, I then asked him, will you collaborate with me on a follow-up study? And he said yes. So we bypassed the standard grant policy. He just said yes and helped me do a replication study. So we gathered the hair samples. We sent them blinded to NIH. NIH measured the samples, and we have partial agreement. We did find that kids with autism had about 50% lower levels of mercury in their hair than the typical kids. But there were a few kids in our study, about 10%, who had extremely high levels of mercury consistent with mercury poisoning. So our interpretation, and our autism mercury levels generally match those of Holmes levels, but our controls are much lower. Her controls tended to come more from a New Orleans area. Maybe it's due partly to eating more seafood there than we do in Arizona, surrounded in the desert. But it's important to note that typical children have mercury levels 4 times above that of mothers in the federal government's national study. So, and also in our previous study looking at moms. So these levels, even in typical children, are high. Also, one of the findings was that oral antibiotic usage was roughly 2 times higher in autism kids versus controlled. That's now been verified in 5 studies that kids with autism have significantly higher oral antibiotic use. And I'll just show you the baby hair data again. It's the median for autism, the median for controls, but the means are similar because there were that 10% of kids with autism who had extremely high levels of mercury. So they probably just became mercury toxic by exposure, but 90% of them it seems to be an excretion problem. So this just shows that data, the difference between the two groups, very statistically significant, P of 0.01. I want to point out that maternal antibiotic use was higher during pregnancy or nursing, and it's known that oral antibiotics pass through the placenta and also pass through mother's milk. The reason it's important is that, let's see if I have the data here. There's several studies showing higher oral antibiotic use in children with autism versus controls. High oral antibiotic use is shown in mice to decrease their ability to excrete mercury tenfold. It takes them 10 times longer to excrete mercury if the mouse is also on oral antibiotics because it alters the gut bacteria and hence alters the uptake and inhibits the excretion. The mercury that gets dumped by glutathione into the intestine just gets picked up and recycled back into the body if you don't have the right gut bacteria. Also, many kids with autism have abnormal gut bacteria. We just published a major study on that. We did then a baby tooth study looking at levels of mercury, lead, and zinc in baby teeth. We found mercury levels were 3 times higher in kids with autism versus controls, and they did not have any mercury fillings in this group. Lead levels were only slightly elevated, so it seemed to be more mercury than lead. I want to ask a question. A colleague of mine at Texas, Ray Palmer, is doing a tooth fairy study in which they're now going to collect hopefully hundreds of baby teeth. And I wonder if some dentists in the audience would be able to help collect some baby teeth from typical kids and from maybe a few kids with autism and actually tell us, verify that they don't have any mercury fillings in their mouth. Just a show of hands. Would some of you be interested in helping collect a few baby teeth? Maybe a few? Great. I'd love to get your names later. I'd share them with Ray. All right, mercury in blood. There was a major study by the largest autism research group called the Mind Institute in California. They get $100 million from the state of California. They get a lot of federal grant money. They found no difference in blood levels in serum in autism groups versus controls. Big study, 300 kids with autism, 166 controls. Almost at the same time, in the same year, there's another study published in red blood cells. And this study was done by colleagues of mine, and they found that the kids with autism had twice the level in their red blood cells versus the controls. And notice that these levels in the serum are dramatically lower, 20 times lower than in the red blood cells. Mercury doesn't stay in the serum very long. It goes to the red blood cell. So where should you look for it? Where it mostly is, not where it's present transiently. So these people should have known better, but that was the measurement that they chose to do, showing no significant difference. This group, looking in red blood cells, found that levels above 15 micrograms liter were associated with a 6 times greater risk of autism, very statistically significant. I'll skip the unpublished data. We did a study looking at toxic metals in blood and urine. This is a wide screen looking at many toxic metals. Unfortunately, we did not have enough sensitivity to look at mercury in these samples, but we did find that thallium, lead in both the RBC and in the urine, and tin and tungsten were all much higher in the kids with autism than in typical kids. And then we also found that these are 3 different autism severity scales. And basically, we do what's called a regression analysis, and we see that we could explain 46% of the variation in autism severity based on these leads, based on these toxic metals. So basically, for these 3 different scales, we could show that the higher the amount of toxic metals, the stronger the association with, the stronger the autism severity. And this just shows you visually. So blue is the controls. We normalize to 100%. Red is the autism. And so higher amounts of lead, thallium, tin, and tungsten in the autism group. So it's not just mercury. These are all synergistic effects with one another. There's also been a study of DMSA. It's an FDA-approved medication developed for treating lead poisoning in children, binds to lead and other toxic metals and is excreted in the urine. There's one study which was very exciting. It's the first animal study to show that if you took a lead-poisoned animal and you then gave it DMSA, you actually significantly improve its ability to learn, its attention, and its ability to regulate its arousal level. It's the first animal study showing that you can affect behavior and learning ability. However, that same study showed if you gave high doses, they used very high doses of DMSA for 3 weeks to rats that were not poisoned with lead, it actually caused a worsening of cognitive ability. So you only want to give DMSA as long as you have other toxic metals to bind to it. When there are not toxic metals like lead to bind to it, then it will remove essential minerals as well. And I'll show you more data on that if we have time. So a number of years ago, I did a study with Jeff Bradstreet. It was a 3-day, 9-dose challenge of DMSA at the standard dose the FDA recommends for lead poisoning. We gave it to 221 kids with autism and 18 typical kids. The kids with autism excreted about 3 times as much mercury as the typical kids do. DMSA, when you give it, it binds to toxic metals like mercury, and then almost all of it, over 90% of it, is excreted in the urine. So the urine is the place you want to look. The levels of lead and cadmium were not much different in those groups. Then there have been quite a few studies now of urinary porphyrins. Porphyrins have to do with kidney function, and there's a pathway for how these porphyrins change. I won't go into all the biochemistry of it, but basically there are certain steps in porphyrin production leading to heme production, and each step is known to be inhibited by certain toxic metals. And there's a particular step for the precoporphyrins, which is seems to be only affected by mercury to the best of our knowledge. So now 106 children with autism versus 107 controls, found half of kids with autism had increased precoporphyrins consistent with elevated mercury. Now these studies were not age matched, so that's a flaw in the study, but now there have been several other studies showing that increased porphyrins are associated with mercury or lead. There's a second porphyrin, coproporphyrin, which could either be inhibited by lead or mercury. You can't distinguish either. But it's a nice screen to see if there is a danger. And the France group actually does these There's several labs now offering this test. There are several epidemiology studies that link airborne toxic metals with increased incidence of autism, and also pesticide exposure. And pesticides, many of them act on the neurotransmitter system, acetylcholine. Most of these pesticides basically designed to cause seizures and basically cause the insect to go into a paralysis from having constant seizures, so it dies. And so it's not too surprising that pesticides that are designed to cause seizures increase the incidence of autism, which is strongly associated with seizures. That's what it's designed to do. Thimerosal and autism, extremely controversial. There's one group, Geyer and Geyer, they analyzed the vaccine adverse effect database, which is a publicly accessible database, and they found that the children who received the DTaP vaccine with thimerosal versus the thimerosal-free version had a higher risk of autism, higher risk of mental retardation, higher risk of speech disorder. They published 10 studies on this now, but there are 5 published studies showing no link. These studies, however, are all funded by the federal government or associated with the vaccine industry. And when you're dealing with the potential of a $1 trillion lawsuit, you have to question the data. The first study I'll just pick on by Verstraeten, we have published emails under the Freedom of Information Act showing that he reports to his colleagues in an email, gee, I found that the thimerosal containing vaccines resulted in a 7 to 11 times relative risk of autism. But then he just kept tweaking his methodology, tweaking it until it was down to a 2.5 times relative risk. Then they watered down their data by splitting it up into different groups, and finally he could say, oh, no risk. So I could go on and on about that, but I'll just leave it, there's a controversy there. But many studies show there is a strong risk. Summary of thimerosal and toxic metals. Toxic metal exposure at dangerous levels is common in the U.S., especially for lead, but lead is a big success story. Lead levels have come way down. Mercury levels have stayed relatively constant. Symptoms of mercury poisoning mimic those of autism, not exactly, but reasonably close. Children with autism have a limited ability to excrete mercury and other toxic metals because of low glutathione. And we know that folic acid, which prevents 40% of cases of autism, is one of its major functions is to raise glutathione. Children with autism have higher levels of toxic metals. There are 40-some studies of this. I've just showed you a few of them. The severity of autism in a few studies is found to correlate with levels of toxic metals. Regression analysis shows, again, that about 40%, not 100%, but about 40% of autism severity seem linked to toxic metals. Several epidemiology studies link toxic metals and toxic chemicals with autism risk. And DMSA therapy removed toxic metals and seems to reduce the risk of autism. So let's see, how are we doing on time-wise? So, oh, wow. I'm going really fast. All right, good. So I'll have time to finish up. So recommendations are very simple. Monitor and treat maternal and child's methylation and glutathione. Now, not too many labs will test glutathione. Only research labs test methylation function. But a very standard test you can do is just measuring homocysteine, which is right in the middle of that pathway. That's often done during routine physicals. And homocysteine is measured because it's a risk factor for arterial sclerosis and heart disease and death from heart attacks. And mothers of kids with autism are at increased risk because they have elevated homocysteine. Reduced use of oral antibiotics. The American Academy of Pediatrics recognizes that oral antibiotics are overused in the pediatric population, primarily due to ear infections. And there's been efforts to reduce the use, but still, we have now 5 studies showing that oral antibiotics use are higher in kids with autism, and antibiotics almost totally stop excretion of mercury. In a human, the half-life for excretion of mercury is about 50 days. If that goes up tenfold, then it's talking 500 days, so about a year and a half. If that infant is also on an all-milk diet, it increases it by another factor of 3. So it takes even longer if you're on an all-milk diet. Reduced exposure to toxic metals, avoiding lead paint, limiting maternal seafood consumption of high mercury fish. which is frustrating because fish is a good source of protein and essential fats. Of course, no mercury fillings. I don't think anyone in this room will disagree, but especially none placed during pregnancy. We didn't find that moms of kids with autism had differences in the number of amalgam fillings. What we did find in a study of 50 moms is that 7 of them had had a filling placed during pregnancy versus 1 of the control moms. Not quite enough to be statistically significant, but certainly pretty darn suspicious. Removal of thimerosal vaccines, it's been done for most but not all, and trying to avoid pesticide use. Well, as soon as we ban one like DDT, we just develop a worse one. And then we continue using it until we do the studies to show it's toxic. Further studies are needed to confirm effect and prevention of autism, but I think these recommendations are awfully reasonable and safe. If you want to read more about a slightly old paper we wrote, 2005, a consensus report on treating toxic metals, that's still available. But now I want to talk briefly about the different chelator options because there's some misinformation out there. The major chelator options, DMSA is the FDA-approved form. It was developed to replace EDTA because it's safer, because it causes less excretion of essential minerals. It's FDA-approved for the oral form, probably works if given rectally, but it does not work in the transdermal form. We now know. It's best for lead. DMPS is not FDA approved, but it is legal to be compounded. It can be given IV, but I've heard of a lot of adverse effects through that. I prefer giving it slowly. Orally, it actually has twice the oral absorption of DMSA, so it's better absorbed. Probably can be given rectally, but again, doesn't seem to have any benefit given transdermally, and it's best for mercury. Calcium EDTA can be given by IV, can be given rectally. It has some absorption orally, but not very good. So it's best for lead, but you have to be cautious about loss of essential minerals. So now I want to tell you about a study, well actually a set of 3 studies we published on looking at chelation therapy for kids with autism. So this is a DMSA treatment study. It was done at, I had to change my hat and become an adjunct professor at Southwest College of Naturopathic Medicine. This is a little too radical for ASU to do a chelation treatment study. It was also funded by the Wallace Institute and the Autism Research Institute. So the first study, we just measured the amount of toxic metals in the urine before and after treating with DMSA. And before, we found that the amount of toxic metals correlated with more severe autism. So the more toxic metals that came out after giving DMSA, the more severe the autism was. That was just from the first round. So that's a good clue as to whether or not to continue going. So we did a regression analysis, and the ADOS, we looked at 4 tests of autism severity. These 3 are parent scales. This is the gold standard for diagnosing autism, done by a clinician based on a 1-hour behavioral assessment of the child. And using the gold standard, we found that 45% of the autism severity, not 100%, but 45% of the variation in autism severity was due to levels, could be predicted based on levels of mercury in the blood at baseline, levels of mercury after 9 doses of DMSA, levels of antimony at baseline, and level of tungsten. So all 4, but the point is that all 4 of these scales were statistically significant, that we found, again, that there's a high level of correlation between autism severity and amount of toxic metals. And now in terms of the treatment, what we did was a treatment study which had some flaws but had some interesting results from it. So it published in 2 parts because there was so much detail. The first was on the medical, second was on behavioral, published in a good journal. Our goal was to determine the safety and efficacy of DMSA therapy, a medication which is FDA approved for treating lead toxicity in children, and we gave it off-label to 65 children with autism. Half of them received 1 round, half of them received 7 rounds. The reason was we wanted to do a screening round, and then only those who had high excretion did we want to continue on. This was the fatal flaw, as you'll see in a moment, because 1 round was enough to do some good benefit. And 7 rounds only didn't help a lot more. So this is just a plot showing how DMSA increases excretion of lead compared to baseline. So for lead, compared to baseline, after giving them 1 dose of DMSA, the amount of lead in the urine went up 700%. it's a good chelator for lead. After giving them 9 doses over 3 days, still a high amount of lead was coming out. All right, so 3 days at standard dosage, still pulling out a lot of lead. Also pulling out tin, bismuth, uranium, a little bit of mercury, thallium, the others too, but especially lead and tin. And then after giving them 7 rounds, so after treating them over 3 months, so we treat them for 3 days on, then 11 days off to let the body recover, then 3 days on, 11 days off. It's very different from standard recommendation in the PDR, which is for lead poisoning, you might treat for several weeks continuously. But after more than a few days, the physicians I work with observe that there can be some worsening of symptoms. So that's why we go with 3 days on and then wait 11 days off. But after 7 rounds, we found that, so each one of these peaks, this is the first dose, this is the 9th dose, this is round 3, this is round 5, and this is round 7 after 3 months. After 3 months, we're still pulling out a lot of lead from the children who completed the study. But having said that, about 20% of the kids with autism didn't excrete much, so we stopped treating them. Another 20% only needed to be treated for about 1 to 2 months, and then we stopped treating them. 60% of them needed to be treated for 3 months or longer. Our study was only designed to go for as long as 3 months. But also amounts of tin, bismuth, mercury were still being pulled out, not in huge amounts. Again, it goes mostly after lead first. We did very extensive look at effect on excretion of essential minerals, and we found it was pretty benign. There was a slight increase in the amount of chromium and a slight increase in the amount of potassium. So potassium, you want to just eat more fruits and vegetables. So basically, 1 banana every 2 weeks would replace the amount of potassium that you lost from DMSA therapy during that time. The amount of chromium, just taking a standard vitamin mineral supplement would be enough to replace the amount of chromium. The loss of the other essential minerals is just a tiny amount of the RDA. So basically, you're losing about 1 day's intake of chromium. You're losing about half a day's intake of potassium while you're on the DMSA. That's averaged overall 9 doses over 3 days. DMSA was found to normalize RBC glutathione. Initially, many children were found to have unusually low or unusually high levels, and this puzzled us for a while, and I'll show you the data and then explain it. This is the normal adult range for glutathione levels in the red blood cell. Some of the kids with autism had very low levels. Some of them had very high levels. After treating them, the levels normalized. This is treating them with only 1 round, with only 3 days of DMSA. Look at the dramatic change. No one had a low level, no one had a high level. We eventually figured out what's happening here, that if you had high levels of most toxic metals, the body responded by making more glutathione. So if you had higher levels of more toxic metals, you tended to have higher levels of glutathione. The exception was mercury. If you had higher mercury, you tended to have lower amounts of glutathione because mercury inhibits the production of glutathione. But notice, whether you had high or low levels, the levels normalized after treating. In terms of safety, we did a standard chemistry panel of kidney, liver function, and other metabolites. And we also did a complete blood cell count, showing no problems with liver or kidney function. In fact, DMSA actually improved platelet count. Many of the kids had elevated platelet counts, a marker of general inflammation in the body, and that actually normalized in a number of the children, suggesting that we're decreasing inflammation. So this is very exciting because there have been some studies showing that maybe 1% of kids treated with DMSA develop problems with liver or kidney function, but those are kids who also have high lead levels. And you don't know, is it the high lead levels or is it the DMSA causing those liver or kidney problems? This study shows at these dosages, it seems to be very safe. We found that on various autism scales, the ATEC, 96% of the kids improved, reported improvement. On the SAS, 61%. On the ADOS, the gold standard done by a clinical evaluator, they reported 68% improved, 15% no change, 17% worsened. So it didn't necessarily help every child, but seemed to help the vast majority of them. So if we average overall 5. The problem is that this was effectively became an open label study because the group that received 1 round of DMSA, their glutathione normalized just as much as the group that received 7 rounds. The best analogy I can give is if you have a headache and you take an aspirin and it fixes the problem, taking 7 aspirin isn't going to help you that much more. So it was very surprising to us that 1 round of DMSA had this incredible effect on glutathione. And so it screwed up our study because there wasn't much difference between the 1 round and the 7 round group. Both groups had dramatic improvements in glutathione. Both groups showed very similar improvements in behavior, although the 7 round group had a little bit more improvement. So we really need to go back and redo the study as a randomized, double-blind, placebo-controlled trial. But this is the first study ever done on DMSA safety in kids with autism, so we needed to look at it. So bottom line is that toxic metals are associated with autism severity. DMSA is a safe way to remove toxic metals, normalize glutathione, normalize platelets and inflammation. Safe meaning it has a toxicity, I would argue, around that of aspirin. You can abuse aspirin. You can take 60 aspirin a day and it'll kill you, but DMSA has never killed a single person, unlike, say, something nasty like Tylenol. All right? DMSA therapy should involve some supplementation with chromium and increased consumption of fruits and vegetables, but you don't need much. The bottom line is 20% of kids with autism had low initial excretion. We didn't bother treating them after 1 round. 20% only needed treatment for 1 to 2 months, but 60% of them needed treatment for at least 3 months or longer, for longer than 3 months. So recommendations, I think the best test of mercury and toxicity, heavy metal toxicity, is just to give DMSA, because if it comes out in your urine at a very high level after giving it, it tells you 2 things. It tells you, first of all, it was in there, and secondly, it tells you the medication's working and is pulling it out. So I think it's a wonderful test we recommend for every child with autism. The problem is we don't have reference ranges for typical kids taking DMSA, so you have to use some clinical judgment as to how to interpret it. And of course, you should only do it under the supervision of an experienced physician, and you should do, just to be safe, tests of liver and kidney function. We didn't see any problems. We actually saw improvements, but I think it's best to be cautious. There might be a 1 or 2% incidence of some worsening. So, hope I didn't talk too fast, but thank you all very much for your attention. And are we out of time, I think? Okay. Can I take 1 or 2 questions? All right, go ahead.